Hello, good afternoon, and welcome to another episode of Fresh Natural Life. We're coming on a little earlier today, and just to let you know, we'll be coming on early throughout the week of February. I'm actually working on a documentary, and I'll be telling you more about that later. We're filming in the morning and the evening times, and so that's why I'm moving the show early in the day. So I was looking at my uh, uh, clock here and the temperature monitor on my watch, and we're here in Houston, Texas, and it is 4 o'clock Central Daylight Time, and it is 103 degrees outdoors. I spent a fair amount of time indoors, but also a fair amount of time outdoors with some of the activities that we carry on. And so I thought about this whole issue of heat stroke, and I thought it'd be a great topic to discuss. So heat stroke is a very important issue to deal with, particularly this time of the year. And so I think you're going to learn a lot from this episode. So before we move on, give us a thumbs up for those of you who are on, and subscribe and share this topic. I think it's going to be very important, regardless of whether you live in the South or in the North. Heat stroke is an important topic. So hang tight. We got a great show for you this afternoon. Welcome back, and welcome back. As I said, we're going to talk about heat stroke today. But first of all, give us a thumbs up, hit the like button, and also hit the share button and subscribe if you hadn't had a chance to do so. Also, hit the bell for notifications to get future topics that we discuss. We like to discuss lots of topics related to health. I go into the science of it, and then I try to break things down for the everyday person. Our goal here on Fresh Natural Life is to help you become the expert in your health and health issues. So we talk about common medical conditions, common health conditions, but we also talk about natural approaches that you can take to prevent the need for coming to see someone like myself or getting some advanced medical care, or requiring some advanced medical care. So today we're going to talk about heat stroke, and it's very important because, this time of the year, especially if you live in the South or some of the southern states, which get hotter this time of the year, especially in the middle of the day, is going to be very important. But sometimes you can have heat waves that go into places like, New York City or Chicago, which typically don't have, extremely hot conditions, and people are not necessarily prepared for them. They can have heat waves there, and heat stroke can be a very major problem. So we're going to talk about this whole condition. What I often do is I go to the medical literature and I look at what's in some of the journals. Today, I'm going to be using information from a review article done about 2 to 3 years ago in the New England Journal of Medicine, and it talked about heat stroke. Now, it's a bit technical. I'm going to help break some of this down, but I'm going to give you my take on heat stroke once I go through all the technical jargon that's discussed in this article. I think it's important for you to understand some of the underlying mechanisms so that, some of the superficial things make sense. And so first of all, they do a nice job of kind of characterizing heat stroke from, I think, a clinical syndrome standpoint. Clinical syndrome is basically, when we talk about clinical syndromes in medicine, it basically deals with a situation of classic clinical observations, could be observations with laboratory tests, symptomatology symptoms that the patient or individual may present with. So a clinical syndrome is a combination of things that you observe in somebody who's presenting to you with a certain illness. In this case, we're talking about heat stroke. And so the clinical syndrome with heat stroke characterized by central nervous system dysfunction, multi-organ failure, and extreme hyperthermia or extreme increased temperature. They get 40.5 degrees Celsius. That's 104, nearly 104.9 degrees, and nearly 104 to 105 degrees Fahrenheit. So basically, if you just sort of step back and squint it, somebody comes in, their altered mental status, and they're very hot. You take their temperature, the temperature is very hot. If you take it orally, maybe it's 102. If you take it rectally, maybe 104, 105. So someone with altered mental status with very high temperature, you got two of those three things, and multi-organ failure. You may not be able to pick that up outside of a clinical setting, i.e. where you can take blood tests or imaging studies, but you can see that maybe the person's not urinating or they're short of breath or something like that. That may be signs of multi-organ failure, i.e. not urinating, kidney being affected, shortness of breath, cardiopulmonary system being affected. So these are little clues that can point you in the direction of, hey, this person is very sick. They've been exposed to the heat, and heat stroke is one of those things. Now, if you're that person, obviously, hopefully someone else is around you who would observe this. So, hello, Jerry Boone. Jerry Boone says heat stroke is the most serious heat-related illness. Heat waves is probably the most of all weather conditions cause the most death of all weather conditions. So I would think of hurricanes and tornadoes and the like. We don't get a lot of news on heat waves unless it's like major, but you can have heat waves that come routine in the summer, and many people die from heat stroke, and it may not make the mainstream media unless you have catastrophic levels or historic levels of heat wave that sweep in the country. Then the mainstream media will pick it up. But you can have heat waves that come year in and year out, and many people may die from that. That's not publicized. So it's a major cause of morbidity and mortality. So let's get into the breakdown. So they look at heat stroke, and there are two basic causes. And I'm going to go to this outline here because I think it's an easier way to look at it. There's what's called classic heat stroke. There's also exertional heat stroke. Now, classic heat stroke is really related to excess environmental heat. So let's say you have someone who's very young, pre-puberty, and you have somebody very elderly, and they are exposed to an extreme amount of heat. For instance, a hot house. You can picture an apartment or house in upstate New York. It's not upstate New York, but maybe upstate New York or New York City, where they don't have central air or any air conditioning at all because they don't, get a lot of hot, weather there. And maybe a heat wave comes through and, sustained for a period of a week. They may be exposed to excess heat for a long period of time. Now, the thought process here is that it's in a situation where it's an environmental factor primarily. The person is usually sedentary, so it's either very young or very elderly person usually sedentary, and there may be some chronic illness in the case of the elderly. Now, the young person may not have a well-defined thermoregulatory system. The person, in particular, elderly person, may be on medications. And the mechanism is thought to be absorption of environmental heat and poor heat dissipation. Sweating is frequently absent. Central nervous system dysfunction is common, respiratory alkalosis. So they can have muscle breakdown. That's that term rhabdomyolysis, what it's referred to, but it's not. It's unusual here, but frequent in the exertional, which I'm going to go through in a minute. Liver dysfunction can be mild, and so on. So it can have a number of different abnormalities that we would look at in terms of laboratory values and the like. So classic heat stroke, very young, very old, usually exposed to heat. They're usually sedentary. And in case of elderly, maybe chronically ill, they may be on medications or the like. There's one thing that's not pointed out here that I'm going to really emphasize when I give my take on this, but we'll hold on to later. Exertional heat stroke is typically when you see the puberty age or older, people are not very elderly. And this is oftentimes in those who are very active. So there's an association with strenuous activity in the setting of hot conditions. So maybe there's someone's out mowing the grass or cutting tree limbs. For example, on Father's Day, I was out cutting tree limbs. It was 101, 102 degrees. I said, well, it feels pretty good out here. I'll share what I did to prevent heat stroke. Generally, the healthy people usually not being used usually they're not on medication, but we have a lot of young, relatively healthy people on medication. So, for instance, example, medication for attention deficit disorder. People may be taking NSAIDs for musculoskeletal aches or pains, or acetaminophen. So even though they are not as likely to be on medication as the very elderly, I would say that many people in this age group can be on medications. Excess heat production. So the mechanism here is that you probably have a combination of environment and activity. So let's say someone who's working out in a hot condition, and so excess heat production is there, and it overwhelms the heat loss mechanism. Again, I have a take on this that I'm going to share with you at the end of the formal initial part of the discussion. The skin can be wet, so there's usually some sweating, but it may not be adequate sweating, and we'll talk about that. Altered nervous system is common, as with both classic. They can have metabolic acidosis, so it's a metabolic breakdown, as opposed to the elderly and young may have a respiratory breakdown. They have poor circulation here. They frequently have muscle breakdown, likely due to associated with the metabolic acidosis. They can have severe liver dysfunction. Kidney failure is common, and marked to severe DIC. That's disseminated coagulopathy, and so that's sort of a bleeding dyscrasia. So they bleed excessively. Kidney function is abnormal, so creatinine kinase can be elevated due to rhabdomyolysis, and then the poor breakdown and perfusion of the kidney will increase creatinine kinase. So increased muscle breakdown will increase it. Poor elimination of creatinine kinase will increase it, and they can have calcium, potassium abnormalities as well. So in the exertional, you'll probably have more lab abnormalities going to see your doctor. So there are two basic types. There's quite a bit of overlap, clearly in the symptom presentation, but the simple thing to remember, very young, very older, they're going to have a classic heat stroke. It's more likely related to the environment, not them being very active. The people in the middle age is going to be more likely related to the activity in the setting of a hot environment. But my take on this is that there's some common denominators. So what are some of the explanations? So the underlying heat stroke explanations. In the classic, again, they think it's weather-related or environmental-related. So heat waves, successive hot days and nights, so you don't have that cooling off period. So if you're a person in a house where it doesn't have central air, you may have fans blowing. That may help to some extent, but you have, 5 days in a row of 100+ degree weather, and you're not able to cool your body down. You're not able to get to a cool environment. That can predispose you to a heat stroke. Physiological factors, oftentimes very old, to some extent very young, can have cardiovascular insufficiency. These patients will have heart failure. And so they have the inability to increase their circulation, and stroke volume is related to circulation. That's the amount of blood you pump out of the heart, amount of volume of blood you pump out of the heart with each heartbeat. Social isolation, so they don't have anyone to get help, unventilated, non-air conditioned living space, as I mentioned earlier. Underlying illness, medication can be a big problem. Oftentimes, elderly people on diuretics as antihypertensive medications, beta blockers, calcium channel blockers, all these can impair heart function, impair volume function, make them more volume depleted. Laxatives can also make them volume depleted, etc. Exertional is social factors. So this is a person out working out. You can picture a young kid on the football team who's, being over-motivated by his coach or his peers to keep going. And so you can have heat strokes in this age group who pass out. I remember when I was young, back in the 70s and 80s. We're in high school football 2 days. We'd be out 105-degree weather. We had black helmets, black jerseys on, and we'd just be out going at it. And we were not as sensitive to these things then as we're now. I remember my first day of 2 days in my junior year, jogging out to the field. The first thing I had a vagal spell and passed out. I came to and just went on through the practice. I remember losing about 20 pounds of water weight after each practice. So each practice about 2.5 hours. Hot sun in the morning, hot sun in the evening. We would hydrate a lot, but we would lose a lot of water and sweat profusely. Functional factors, low physical fitness, lack of acclimation to the weather. One thing, living in this area, acclimate. And when you acclimate to a hot condition, your body blood plasma level builds up and increases. So you tend to have a higher blood plasma level. If there's high altitude and hot conditions, then your hemoglobin levels may pick up. So your body physiologically can adapt to the conditions of heat and altitude in some cases, in which case it will help mitigate the potential risk of heat stroke. Low work efficiency works against you, being overweight and having too much protective clothing. Sometimes viral infections, chronic inability, familial or idiopathic inability to sweat. That's anhidrosis. Can be a problematic. Of course, medications can be a problem. In this age group, I tend to take a look at alcohol or attention deficit disorder medication that can increase. Alcohol potentiates dehydration, and certain ADHD medications potentiate increase in adrenergic drive and increase in heat production. Now, I really want to talk about this thing. So there's a mechanism here. And mechanisms, I like to think of mechanisms. I like to think of disease states in the context of mechanisms. And this is really going to help us all really get to the core of what's happening, because, I think this article is pretty decent and fairly thorough, but I think they, in my opinion, they don't emphasize a central theme enough. And here's where it is. So compensable. So your body has a natural physiological compensation for increased heat. So you exercise or heat stress, or so any kind of an increased heat production, you have an increased metabolic rate. All that means is that the body's build up and breakdown of tissues and molecules increase, and this is associated with increased heart rate, increased blood flow, etc. So the core body temperature increases as a result of the increased metabolic rate. And so to keep the body core temperature cooler, you're going to have to release fluid. Sweat mechanisms is very important. So sweat is a very important mechanism for body temperature control. And so in order to sweat, in addition to have normally functioning sweat glands, so if you don't have a idiopathic or an acquired anhidrosis or abnormal sweat mechanism, then you should be able to sweat normally. Now, the other important factor of being able to sweat is having adequate body volume, okay? Hydration. So what I want you to do is put a pin in that hydration. Hydration is key right at this point here. If even with normal sweat glands and normal ability to sweat, if you're not very hydrated, you will not sweat, or you will not sweat adequately. Very, very important. Now, this next mechanism, you have to increase cardiac output. What does that mean? That increase the body circulation, increase the amount of volume of fluid that you're circulating throughout the body for a certain unit of time. Why is that important? Because it allows you to shunt blood from the inside of the body, so you constrict blood flow to the core of your body, and you increase blood flow to the skin. Why is that? Increasing blood flow to the skin helps cool you off. The blood the body is normally warm, thermal temperatures are getting hot, so you shunt it out so that heat can dissipate more easily. That's complementing the sweating mechanism. So you want to decrease visceral blood flow and increase peripheral or skin blood flow, and that helps you cool. Now, not only should you have adequate volume and adequate cardiac output, but your blood vessels must be in good shape. So normal vasomotor function. What I mean by that, blood vessels are not just, pipes that just are in a fixed, diameter. They can dilate as needed. They can constrict as needed. If the body says, well, I need to shunt blood from area A to area B, so I'll constrict the flow to A and dilate the arteries and increase flow to B. So that requires a normal cardiovascular system that's functioning, that's interacting with the neurological system, and in this case, interacting with the thermoregulatory system, which feeds into the neurological system. So if these mechanisms are not working, your body's not able to function, then the cardiovascular function is abnormal. So we have volume, hydration being an important part, and added cardiac function, cardiovascular function, a normally functioning heart, so it can increase cardiac output, normally functioning vessels, so they can increase shunting of blood where it needs to go and shunting of blood away from where it doesn't need to go. That's the key to the normal compensation. Volume sweating, volume increased cardiac output, normal cardiac function, normal vascular function. Those three key components I think are important. If you're not able to compensate, then decreased central venous pressure. Now, what is that? Central venous pressure, there's a large vein that travels through the body called the inferior vena cava. And that your body volume, think of the veins as your capacitors for volume. So the veins can serve as a capacitors for volume. That means that the amount of volume you have stored, much is going to be stored in the venous systems or in the veins. And the veins, by definition, deliver blood to the heart. So if you have a decreased central venous pressure, that means you have a decreased amount of volume. You have a decreased amount of volume in your bank account. And so when it's time to increase cardiac output, you need to increase output. You need to tap into those volume reserves. But if they're decreased, you have little or nothing to tap into. So the first problem with the inability to compensate starts with what? Decreased volume. So that's why I like to emphasize volume or hydration being an important component to being able to compensate, or on the flip side, to the lack thereof is central to not being able to compensate. So when you have decreased venous pressure, you have increased core body temperature. Increased core body temperature, the body temperature itself, the body starts to cook, literally starts to cook. Cell anoxia, gastrointestinal permeability, cardiovascular collapse, inflammatory reaction. Your body starts to literally cook. It becomes inflamed. Cells start to suffocate due to the lack of oxygen. Your gut starts to become leaky. It starts to leak out inflammatory molecules that results in systemic inflammation. Okay, systemic inflammation increases core body temperature because all these biochemical reactions are occurring, which increase heat. Central nervous system. Your brain is very sensitive to increased core body temperature, so you start to have central nervous system dysfunction as well as the liver. This is the multi-organ dysfunction. Okay, so coagulopathy, muscle breakdown, cardiac dysfunction, renal function, liver dysfunction, central nervous system dysfunction, and then you go into full heat stroke. So you're starting with low volume, and with the low volume, you can't have these compensatory mechanisms. The lack of compensatory mechanism results in increased core body temperature, which then the body starts to cook at the cellular level. Cells start to suffocate, gut starts to leak, and the heart starts to fail. A circulatory system starts to fail. Inflammation kicks in, and with increased inflammation, increased core body temperature, and multi-organ failure, heat stroke. In the elderly, the mortality is greater than 50% upon diagnosis. It's very rare among the younger because there's probably some compensatory mechanisms going on. And in fact, if you look at, let me go back to this other slide. Excuse me for going back and forth. If you look at exertional heat stroke, which is usually in the relatively young, for instance, the post-puberty to active young age, these are people are exercising, they're still sweating a little bit. So there's still some amount of volume there, even though it's not adequate. So even though they could have severe lactic acidosis and other things, upon diagnosis, typically they're caught earlier and they can be cooled down and hydrated, and the mortality is less than 5%, as opposed to in this group, which typically the elderly, which typically are caught later, and the mortality is much higher. But they tend to have less sweating. They tend to be more volume depleted because the medicines they're on, because they have poor thirst mechanism, not drinking as much. And so the acceleration of heat stroke, I think, is more rapid in this group. In addition to the fact in addition to low volume, they have worsening cardiovascular function, typically in the elderly age, and more likely to be on medication. So kind of a trifecta of sorts. And so, again, very important differential. We're going to talk about some things you can do to prevent that. So, diagnoses. Diagnoses goes into clinical observation by and large. And so some with altered mental status, increased body temperature, and some evidence of some organ dysfunction, shortness of breath or chest pain or whatever the case is, you want to consider them as having a heat stroke, especially with altered mental status or increased body temperature. Treatment. Well, if somebody's in cardiac arrest, you do CPR, but shorter during CPR, we want to decrease the core body temperature, and you want to give IV fluids. Let's say, for instance, you don't have intravenous fluids, and you recognize somebody to be very cool. First thing you want to do is get them into a cool, air-conditioned place, at the very least shades. You want to pour cold water over them, while at the same time trying to get them to drink cold water. If you don't think they can drink very much, have them consume ice chips, something that's going to hydrate and decrease cold body temperature. Oftentimes, by the time they have altered mental status, they might not be able to drink adequately on their own, but you try to have them drink or sip ice chips as much as they can, and you're pouring cold ice water over them, trying to get the core body temperature down. And at the same time, of course, calling for medical help. Seizure medications, benzodiazepines, now these go into more of an acute treatment situation and a medical condition, medical environment rather. Treatment in the emergency department, core body temperature, you want to measure the rectal temperature and cool the body temperature by 10 degrees per hour at least. If they have seizures, treat the seizures and get laboratory tests, things that look at complete blood count, look at renal function, liver function. You want to get blood gases, measure inflammatory markers, get blood tests that look at all of these things to see where that person is in the area. So if I'm treating someone in the emergency room with who's altered mental status, blood pressure low, I'm going to get IV fluids in, hopefully IV bags that are cold. We're going to get cold, put a cold blanket over them, cool them, get hypothermia, and then treat any symptomatology as they occur. More advanced treatment, monitoring circulation. Again, IV fluids is important. You want to measure their volume status, measure your output. Again, these things are looking at volume status. In more severe cases, CPR using ACS protocol. ECMO stands for extracorporeal membrane oxygenators. This is a heart and lung bypass machine. These are severe cases of people in cardiogenic shock. Where you would take over their breathing and circulation mechanically while you support them and hopefully get their organs to recover. You're going to monitor the temperature, get the temperature up, monitor metabolic labs. Heart failure, again, CPR is performed in some of the acute failure, but acute decompensated hemodynamic status. But you'll treat them, again, IV hydration. You also want to treat them with drugs that will improve cardiac output. I might give milrinone. I rarely give dobutamine with these patients or adrenaline. And if they're in cardiogenic shock, maybe. But milrinone decreases, vasodilates, and increase cardiac output, which is what you want to do. Some of these other drugs, IV adrenaline, can constrict, although they increase blood pressure. You may want to do that for a short period of time. You want to do that. So I don't want to go through this very much because it goes beyond the scope of the discussion, but kidney function, kidney injury, that's going to be treated with hydration. Rhabdomyolysis will be treated with hydration. DIC, you're going to treat that as needed. So if the platelets are low, you're going to treat a fibrinogen if they're bleeding out. So all of these things are important. ARDS, that's systemic inflammation in the lungs, acute respiratory distress syndrome, liver failure, of course. You're going to treat that with supportive care, hydration, improving cardiac output. You want to minimize drugs that are metabolized through the liver. Somebody has a medication for statins or something, you're going to stop all of that. EKG changes and things. So you'll treat them like sepsis as a common association between heat stroke and sepsis. And that's due to the fact that in heat stroke, once the core body temperature goes up, the gut leaks out cytokines, which triggers a systemic inflammatory condition. Prevention, what I'm going to do is I'm going to go to another article that talk about prevention. I think they did a pretty decent article in discussing some of the pathophysiology. In this article, I don't think they put enough emphasis on the mechanism of volume depletion and poor cardiovascular output. That's sort of listed as one of many things that could be happening, but I think those are the cornerstones. So here's an article from Mayo Clinic I'm going to go through quickly, and it talks about symptoms, which we covered briefly, and it talks about things you can do to prevent it. And I'm going to hit the high points here and then give you some of my takeaway points. After that, I'll look at some of the comments and address any questions from the core group. Before I get to this, a reminder to hit the thumbs up button, share, subscribe, and share this with loved ones, anyone who you think may benefit from this, because this is the time of year that you're at increased susceptibility for heat stroke. So symptoms, as we talked about, increased body temperature. That's something that you can pretty much measure. Sometimes you put your hand over the forehead, it's very hot. They come in, let's say the classic picture, you're going to, grandma's house and grandma's not quite with it and she feels a little warm. Those two things might be enough to say, well, grandma may be in the early phase of a heat stroke. If the hottest house, the house is hot, the house is hot, then you may want to get grandma in an ice bath, or just get some ice, bags and put over grandma and ensure that she drinks ice cold water or ice chips, things to hydrate her and get the core body. Drinking ice cold water, ice, chips, preferably ice water, does two things. It helps with hydration and helps with decreasing core body temperature. So you can do that. Altered mental status, as I alluded to, altered sweating. Grandma may be dry and sticky, but maybe a friend or a loved one who's been working in the yard all day or exercising, they may be sort of, damp or clammy, but not profusely sweating. If you're working out in the heat, you want to be profusely sweating. When I work out, I was working out this morning with our filming our documentary, and we go through rigorous workouts, and I encourage all the team members working out to hydrate and to the point where we're profusely sweating. When I'm dripping all over. My shirt is soaked. That means you have excess volume, put out lots of sweat, shunting blood to your periphery, and you want to do that. In fact, before you work out, you want to hydrate yourself so much that you're urinating a lot and the urine is clear, crystal clear. And so that implies that you have excess hydration. So when you go into the workout, your central venous, filling pressure is very high, and you have those reserves to pull on when you're working out. Nausea and vomiting, flushed skin, all these things can occur, racing heart. They're non-specific per se, but if you have high, altered mental status, increased core body temperature, have one or more of these, you're going to be really alert to that fact that person has heat stroke. You want to start hydrating and decreasing temperature right away, and then calling EMS, doing those three things, getting emergency medical personnel there as well. Take immediate action, as I said, get them indoors, cool them. Exposure to a hot environment and strenuous activity are the two environments, or two main things. Those are your clues. So if they're working out in the heat or sitting around in the heat, excessive heat, if they're older, medications, in the excessive hot environment, that's a clue. And becoming dehydrated, I want to emphasize that drinking alcohol contributes to dehydration. Wearing excess clothing prevents them from dissipating heat. So you wear excess clothing in the wintertime to hold on to heat, but in the summertime, you wear less clothing. You want to dissipate more heat. So becoming dehydrated is a critical factor for the reasons we mentioned above. Again, H factor, exertion of hot weather, sudden exposure to hot weather. So sudden exposure means you hadn't had time to acclimate to hot weather, lack of air conditioning, certain medications. I can't overemphasize medication, those things you overlook, but if somebody's taking a blood pressure medication, there's a fair chance or a good chance that they be on a medication that dehydrates. Hydrochlorothiazide's one, or other diuretics will be associated with medication taken. So if they're taking medication out in the hot sun, they can become dehydrated. Vital organ damage, death is again very likely. You want to wear lightweight clothing, loose-fitting clothes, t-shirts. You want to expose more of your skin to where, again, emphasize drink plenty of fluids, drink plenty of fluids, drink plenty of fluids. That's the most important thing you can do. And if you have a loved one who's a senior citizen who's in a house exposed to hot conditions, you want to get them in the habit of drinking fluids. Also, lots of elderly people may not drink water. The thirst mechanism are off. But let's say if they like cantaloupe, watermelon, some of my elderly patients, I have them eat like half a watermelon in the morning, a whole watermelon in the morning. It helps hydrate, plus it gives them some calories, but it's something they enjoy, and it's going to hydrate them along the way. So this time of year, watermelon is in season as well as other melons, and God probably designed it that way so that foods that are in season, we're eating, we're hydrating more during this time of the year. Of course, with kids, don't leave them in a parked car alone. Get acclimated to the environment you're working on. And so you just move to an area you want to get acclimated. So these are the general points related to heat stroke. And I think the articles are generally good. I would tend to emphasize from a mechanistic standpoint, a poorly functioning cardiovascular system in the setting of somebody who's dehydrated or volume depleted is going to be the cornerstone of your setup for heat stroke. And the hydration, while you may not be able to improve your cardiovascular system like on the spot, you want to hydrate as soon as you can, as soon as symptoms are recognized, hopefully before, as a prevention mechanism. But other things you want to do to improve your cardiovascular system, as we talk about, healthy diet, regular exercise, maybe an ambient condition, get your cardiovascular fitness level up. But a natural healthy diet, a plant-based diet, reduces inflammation, reduces atherosclerosis, improve vascular function. All of those things are important. So when you're predisposed to an environmental setting where heat is there, your cardiovascular system is better than it would be if you're practicing eating natural, plant foods, melons, even leafy greens, cucumbers, carrots. All those foods are high percentage of water, and consuming them in the raw state is going to be very, very important because the body uses that to hydrate. So those are the comments I have. Jerry Boone has a lot to say on this. When heat strokes, you give a nice definition of heat stroke. I'll share it just so you can take a look at this. But they say it can rise to 106 degrees Fahrenheit. By the time you get to 104, you probably have advanced symptoms. Yes, you should hit the thumbs up. Danielle Harding, thanks for reminding me of that. So here, extreme heat is a threat to lives in Africa, but it's not being monitored. Okay, it's an interesting comment. Thanks for the timely topic. You're welcome. So here's someone with a story. My husband would practice football in the summer, son throughout high school before he lost his sight. Youth was on our side. That's true. And I alluded to my old high school days when I practiced football in the hot sun. It was 105 degrees some days. I remember one very hot summer, black helmets, but we hydrated very well. Also, when I prepared for 2 days, I would go out and run in the heat of the day. Plus, I was acclimated to the weather. So I was young, acclimated to the weather, physically fit, exercising on a regular basis, exercising in the heat and hydrating. And so I would sweat profusely during the practice. And so my body would be able to maintain a reasonable core temperature. So all of those things are important. I think, yes, heat can be problematic, but sunshine is good for us. And I'm not saying go out in 101, 105 degree weather and exercise, but what I'm saying is that you have to be exposed to the sun as part of our normal environment. But we have to properly nourish our bodies, have our bodies in shape. We should not be relying on medication. It goes to the fundamental things we talk about all the time on the show. Natural health is beneficial all the time. So whether you talk about diabetes or heart disease or kidney disease or peripheral vascular disease that we've talked about here we're talking about heat stroke, which you normally say, okay, that's an environmental insult, but that's true, but it's an environmental insult on a body that's not physiologically optimized. The body's not physiologically optimized, has an impaired cardiovascular system, so cardiac output cannot increase with demand. Vascular system's not able to respond appropriately, and the body may not be hydrated. So all of these things are important. So what you do, to your body, for your body, chronically is important, and hydrating your body both chronically and acutely is also important. So hopefully that was good information to you. Again, hit the thumbs up button, share this information, and hit the notification bell to get more information. And until next time, keep it fresh, natural, and live.